provisions in your policy for a procedure of this magnitude.
So what's going on, guys? As you guys can see, I'm still working on the new streamware that we are using, and yes, of course, I do love it, and I'm figuring out how to give you more. So this is your step-by-step book, okay? And this is what we're doing. Some of you who are already in this classroom know which book that we use, okay? And the step-by-step book is what we use with the ICD-10, okay? So don't sleep on that, okay? And you guys are already doing what you're supposed to do. You guys are already doing what you're supposed to do. We had class yesterday, and it was lengthy. And we also having class today only because the ICD-10 is very long. Your normal days are Monday, Friday, and Saturday. I'm just putting it on the side, which most of you know already anyway. The only thing I kind of changed up now is pretty much the date of when you guys are having your class. Okay, so again, this is where we're at an overview. So now I have something up as far as when I want to get ready to show you where we're at. So we're already here, and you guys have already done this portion and most of this portion. Okay, so your guidelines have been done. You've read your guidelines several times, whether it's from CMS or XYZ, you still read them. Okay. Um, your ICD-10 book should be present. It doesn't have to be new. You guys saw yesterday I had my own book. Okay. This one is 2025. My ICD-10 here is 2025, but I had to show you that because I couldn't really show you here what we were looking at. But again, I'm going to kind of toggle through from ICD-10 to step by step, just to put you in the right place as far as where you should be, where you should be. So right now you should be here on ICD-10 overview, and chapter 2 is fairly long. So that's why we needed to do it for a couple of days, absolutely. And I want you to start getting the feel of what you're supposed to be doing, okay? So when you get used to doing the coding, I'm just gonna flip out real quick. When you get used to doing the coding, all of this will come natural to you. You will know how to find these codes. So right now I'm just kind of backtrack on what we did. So the ICD-10-CM, we did the guidelines, right? And I don't know who this is going to be. And in those guidelines, I thought I had the phone down. In the guidelines, it pretty much showed you what steps you're going to take to start coding. It gave you the conventions. It gave you subcategory, category classifications. Um, this is now, again, the step by step, and you're combining the step by step with the ICD-10, right? You are combining the step by step with the ICD-10. So in the ICD-10 book, you've already done your introduction in the ICD-10 book, and you've already done this portion. Remember, in the ICD-10, we did pretty much the history of ICD-10, where it came from, who is World Health Organization, CMS, AHA, things like that. We went over those things already. Just kind of showing you where we are and what we went over. So, and again, this is a step-by-step book, and it's a little bit more detailed than what you've seen in the ICD-10. So I'm just kind of scrolling through. We've already done this, and this is the exercises that you already did, and it's just asking, about the history. The I-10 was originally issued in 1993, XYZ. You've already done this, just backtracking of how we started ICD-10. So you've done this already, and this is a step-by-step book. So just remember, this is a beginner class. In the beginner class of the step-by-step in the ICD-10, we show you the history, we give you the conventions, the symbols, and you go over the chapters. Yesterday we went over chapter 1, infectious disease, and we went over chapter 4. Was it endocrine? I think so. So today we're trying to finish this sector. So these are open and closed questions. This is, let me show it again. When I say open and closed questions, this is what I mean when I say open and closed questions on the CPC or XYZ. Okay? Open and closed as in multiple choice. Give them the answer and you're done. Okay? I'm still struggling with the head. Trust me. Yeah, I know. When I wear the ponytail, I don't have no problem. When I wear the ponytail, I can wear it for 2-3 months. So okay. Let's get this down. So again, we're just kind of backtracking on what you've already done. Okay. And again, if you have the step-by-step book, your answers are in the back of the book if you want to check your answers. We went over ICD-10 format. Now remember, I'm in the step-by-step, but we're going over the same thing. It's just more detailed. Okay. In here, they start talking about the CMS 1500 healthcare claim form. That's more in the classroom, but you guys can take a look at this. Take a look at the claim form. I think that those of you who have not seen a claim form, there is one in your step-by-step book, and this is it right here. We have one in the classroom. Same thing, just kind of like a regular one in the classroom. That's all. Okay, so and if you want to practice that, that's fine. This is actually in the classroom. I don't know why this is on like that. This is in the classroom. Let me see. Okay, no, that's fine. You can leave it like that. So, you see so many different things in the classroom that this is also in there. It's just red and white. It's just a true color. It doesn't make a difference. I mean, years ago we used to do we used to send Medicaid claims out one by one years ago, and these were the claim forms, the one I just showed you. So again, it's just giving you an idea of what this is. And you guys on YTU, you can look at this. You guys that are in Sapphire Academy, yes, we go through this detail for detail, and you guys do have to fill this out. Again, if you guys want to do the Sapphire Academy, make sure you go to my website. Okay, so there are 4 groups whose function it is to deal with in-depth coding principles and practices. Okay, if we went over that in the beginning, in the guidelines, right? Center for Medicaid and Medicaid Services, CMS, Healthcare Financing Administration, HICFA, HCFA, National Center for Health Statistics. I can't even say it. Health Statistics, NCHS. All right, AHIMA and AHA. AHIMA, American Health Information Management Association, and American Hospital Association, AHA. Yes, I want you to get those down. The reason being, these may be on your test. So those of you who are headed toward your CPC, what you just heard me read, this is right here. I don't know if you can see it. You guys are on your phone. Um, those are acronyms we need to go ahead and get down because they may have that on your exam and or you still need to know it. Okay. The index, the ICD-10 index is alphabetic. As illustrated, the I-10 index presents the main. They just use an I-10 and it's a shortened CM. That's all. Index presents the main terms in bold type and subterms indented. This is the same thing that you already read. Do you have to still read this, Miss Lambert? Yes. So you've already done that. I'm just kind of backtracking. We've already done the beginning of chapter 2. A lot of you have already done chapter 2. I just want to make sure you guys are all in the same place. So, in our ICD-10, you remember in the ICD-10 when we were going over the chapters, right? Section 1. Then you saw the chapters. I didn't get to put it up before, but I'm gonna put it up now. When we get to the chapters part, I mean, some of you are just popping in, some of you are maybe just joining the YTU. But in your guidelines, if you have the CMS guidelines or if you have your regular ICD-10 book, you have to know how the ICD-10 is formatted. I'm not sure why this is not open. You have to know why, not why, how it is formatted. The why is some of the history that you've already read in the beginning. Okay, so I'm gonna try to get that up in a few minutes. I'm not sure why it's not opening. I'm gonna backtrack and come out. Okay, hold on. So if some of you, I forgot to mention, if some of you are using the book from the Kindle, again, the Kindle will not go, give you a full book, but it'll give you some insight as to the ICD-10. I think it'll take you to maybe about 800 pages. I'm exaggerating. I don't have it in front of me, so I don't know. So let me backtrack so you can see where I'm at. So after you've done the guidelines, okay, the A and the B, you remember I told you to do the A and the B. This is where you should be now in combination. This is where you should be now in combination with your step-by-step. Okay, so you should be in combination with that. This is where you should be. So this is where I was talking about your section and your chapter 1, okay, your chapter 2. Remember we were talking about that, and this is where it gets more detailed. This is where it gets more detailed, okay? And some of you, like I said, are in the front. Some of you may have a book that has your tabular list in the back, okay? This is your alphabetic index, okay? This is your alphabetic index. This is part 2, okay? This is part 2 of your ICD-10 book, okay? Introduction, you guys, I'm assuming you guys can still see. Let me just make sure you can see. I'm flipping through the book so you guys can still see. So you need to know parts of your book, okay? And this is where the tabbing comes in. Introduction, you have read your introduction. You saw a lot of the in illustrations, okay? That's in 1. That was the introduction, okay? And then we started talking about the alphabetic index. Okay, remember we started talking about that, and you guys was to go to page. Okay, we mentioned the table of drugs, external causal diseases. page to page. That was your homework from the first time we did it. So you guys can kind of get used to your book. Okay, so now we are doing C, just kind of getting a detailed orientation on the part three. The part three is your tabular list in the back of your book. And I want to show you, see how, let's do another one. All right. And we can do this one. It's not a big deal. Okay, so we can do chapter two. Chapter two. So again, this is at the beginning of each chapter, there are guidelines. So this gives you another opportunity to continue to read your guidelines. And the guidelines, being here again, shows you how important the guidelines are, and the fact that they want you to, okay, you want us to read this again. So in the beginning of the book, there's the guidelines in there in your introduction, right? Then it's still introduction. Part two is still talking about alphabetic index, and then part three, you're talking about your tabular list, right? At the beginning of the tabular list, there are guidelines. So there's no way you can get stuck. Everything you need to know on that exam is in your guidelines. If you get stuck on how to code something, it's here. Okay, and this is what I like right here. It's treatment directed at the malignancy. Let me put this up. I'm not going to read it. You guys are going to do this. This is your homework. But I wanted to show you this because in the ICD-10, it's explicit on explaining to you why you would code this with that. It even tells you about a specific disease. It's not just telling you about the ICD-10. It's telling you about the system that the provider is talking about. Okay. If the treatment is directed at the malignancy, designate the malignancy as the principal diagnosis. You see how it's just telling you? It's telling you how to code a malignancy. The only exception to this guideline, there are guidelines, right, is if a patient admission or encounter is solely for the administration of chemotherapy, immunotherapy, or external beam radiation therapy. Now, you're going to see this in the records. You're going to assign the appropriate Z51. You guys can go find that if you want to. Code as the first listed or principal diagnosis, as this diagnosis or problem for which the service is being performed as a secondary diagnosis. Now, they're saying if the patient is coming for chemotherapy, the chemotherapy is the first listed diagnosis, and then the second is the cancer. Okay, so again, the more you read this, okay, let me put it right here. The more you read this, the more you understand the coding. This is your go-to. Now, the diagnosis is going to be the easiest thing that you're going to do. Identifying what's wrong with the patient is going to be the easiest thing you're going to do. Your fickle is going to be the procedures. But we ain't up to that yet, so don't get yourself in a bucata, okay? I don't know what bucata means. Don't tell me. Sometimes I say words that make no sense. Okay, so yes, I want you to look at that. Yes, yes. No, Trina, this is a whole different thing. I have another screen up, and Trina's asking me whether the CPT, the procedure coding, will be the same process as what we're doing in the ICD-10. No, totally different. You're going to go at that totally different. My goal at this point is to make sure that you understand the guidelines as to what you're coding. Okay, remember, we're taking alpha, turning it into numeric. Okay, I'm on page 623. Okay, I'm in the ICD-10 book. Anemia associated with chemotherapy, immunotherapy, and radiation therapy. Okay, you guys are to read all of that when the admission encounter. When we say admission and encounter, when the patient is present, The patient may be there for an encounter, as in to go home, or if the provider makes a decision to admit the patient. So it can be an admission or it can be an encounter. Encounter as in he's going home, or encounter as in we are seeing the patient today, this is what happened, he is here for an encounter, this is what happened, or he is admission. He's at the counter registering, the patient is there, seeing the doctor, the patient may go home, okay, or the patient may be admitted. So that's why when you see it says when the admission slash encounter is for management of anemia or whatever, that's just what it means. It's just and or, okay. Management of dehydration due to the malignancy, treatment of complication, primary malignancy, admission encounter involving chemotherapy, yes. And like I said, try and find a spot where you can do this reading. Oh, this is perfect right here. I'm actually in the chapter 2 on K in K. So I gotta give it to you this way. So if I am in 2, right? So I am in 2, period. D. Let me see where I was in D. D no more. Where's what I want to show you? K. So 2K1. 2 decimal K decimal 1. That's where I'm at. Okay? So 2, chapter 2, right? I'm in chapter 2. K, malignant neoplasm without specifications of site. And then I'm going to do 1, sequencing of neoplasm. If she says they want to go further, then after the 1 period, then I'm going to go 2. Let's say 2 as an encounter for treatment of secondary malignancy. So I'm on chapter 2, guys. I'm going to show you what I'm looking at. And the reason why I'm giving it to you in code form is because that's the way they will give it to you, in a code format. So what I just did was just take what we are studying and I put it in a code. I put it in a code form. You should know what that code form means by now, because we went over that like I can't express how many times. So I'm gonna turn this whole thing into a code form, and then you're gonna get right to where I'm talking about, because on the CPC they're gonna give you code forms and you're gonna have to find it in your guidelines. So if I say we're in chapter 2, so 2, right? 2 means we're in chapter 2. Okay? 2 means we're in chapter 2. So now I'm looking for the area that I'm in. So 2 decimal. Right? You can say 2 period. 2. Now I figured out how to write on this thing, but I can't wait to get savvy with this. 2 decimal, right? Now I'm down to K. Okay, you remember we were in K. So 2 decimal K. 2 as in neoplasm, period. K, malignant neoplasm without specification, period. 1, sequencing of neoplasm codes. 2, period. 2, encounter for treatment of secondary malignancy. Now, just think of that without, let me get my pen. Just think of that without me telling you the words. 2, period, K, period, 1, period, and 2. So it would be 2K, I2. You would see them with a 2 like that. You know how you do the 1, 1, and then you make it like that? That's how it would be. Okay, even right here, let me show you something. So when you see this on your test, and then maybe they ask you, I don't know if you can see this or not, but you see how it's, what is it, Roman numeral numbers, that's what you call them in junior high school? Yeah, that's what they are. Okay, the Roman numerals right there. So you see 2, and then period, K, period, 1, and 2, and that's where I'm at. So what I just did was just decipher this whole thing. I just deciphered this, right? Because here we are. Okay. Even though we're in chapter, we're actually in part 3. We're in the chapter list. So it would be the 3, not the 2. Okay. But that's just a quick way of showing you what what the coding actually is. And some of you already know what the coding is, but to take that guidelines, because they're still guidelines, to take those guidelines and turn them into that code that I just gave you. So you are in part three. You're in part three, period two. Don't do two. Part three, period K, 1, 2. So you know what that is without me telling you what it is. So if you had a case at the facility, or a case on your CPC, and they gave you a numeric code like that, you would go find that in the guidelines. It is the same thing. Think of it vice versa when you're coding a case. Pull out what you need, turn that into a code. When we get to the procedures, you'll understand a lot more, because the diagnoses are fairly easy. I mean, you can identify a patient's issue. You go through your guidelines. You find it just like you find in a dictionary. You're going to check it in the back. You remember they said to check it in your tabular list. Okay, so that's what I want you to do. Make sure you check it in your tabular list. Okay, so no, Morgan, we're in this section until we finish, and then we get to the procedure codes. Morphology. Make sure you guys get morphology. Okay, functional activity or neoplasms are classified in sections. Now, the neoplasm section is going to be a little bit rough. I'm gonna tell you right now, because we have to go through that page by page. That's why those of you who are setting time for yourself for the study, I want you to go through your book page by page. Why, Miss Lee? Y'all know I say it all the time. Because you have to get used to your book. The purpose of the CPC is to show the world that you have mastered this book. Show the world that you have mastered this book. As you read this book, it will begin to become second nature to you. It will become second nature to you. You see how I'm going through this book? Let me put it up. I'm gonna show you how I'm going through this book. You are to go through this book the same way how I'm going through this book, how I'm teaching you to go through this book. Okay? You will know that the C codes are neoplasm codes. Remember yesterday when we were talking about there were two different types of codes? There was going to be C codes and D codes in the neoplasm. As you are looking at this section, when you get to in situ neoplasm, we're going to go over that, what in situ is, DOO-G09. So I'm on page 625 in my ICD-10 book. Right here. In situ, the cancer is in situ. The cancer is in this right here, and it is growing in this. I can't even show you. It's growing in this area right here. Let's say this is a cancer, God forbid. This is a cancer. In situ is this. In situ is right here. I'm saying in situ, but it's in situ. It's right there. Okay. And we were talking yesterday about the C codes and the D codes. In the neoplasm section, it changes. The C codes of the neoplasm section and the D codes are also in the neoplasm section. So that's probably the only funkiness that you're going to get from the ICD-10 book is the neoplasm. So that's why we're going to steadfast on the neoplasms when we get there. But make sure that you remember that when you are looking for that code, you know that the neoplasm chapter is what? Is C and D. Absolutely, it's C and D. So that's another reason why I want you to just turn pages in the book. If you've never done the coding before, if it is ebonics to you, the only way that you get used to something is you have to visually see it. You have to visually see it. When you start coding, and you guys know I say this all the time, I don't want people to be scared of coding. But when you start coding in your mindset, you're like a surgeon. You guys, you hear me say the billers talk billing, anesthesia talk anesthesia, the coders talk coding, the surgical surgeons talk surgery, medicine doctors talk medicine. You will have to start deciphering and getting used to those type of talks, because you as the coder will be diving into those reports the same way that the providers are diving in and dictating those reports. Put yourself in the OR. Put yourself in the OR looking over the provider. That's why I said make sure you use YouTube. If you have a case, when I start giving you those cases, we're gonna start with open and close, and then when I start giving you your cases, I want you to pull a case up on YouTube so that you can see cardiology. I don't know if that's gonna be first or second or whatever, but I'm giving you an example of cardiology. If you have a case with cardiology, because I'm gonna give you a long one. I got several long cases, trust me. I want you to look it up on YouTube. As a matter of fact, you don't even have to look it up. I'm gonna put it in the class. When we get ready to do that surgery, we gonna have so much fun with procedures. Y'all gonna trip out. Y'all better watch the videos. I'm gonna put the actual surgery there. Why, Ms. Lambert? Because I want you to see the surgery. Let me tell you something. I have been blessed to be in the OR during surgeries. And this is before I even started doing the coding. And that's why the visualization, I can't even say it, of being in the OR is so important. I just moved the whole screen. I don't know about that. Use YouTube. Use YouTube, because that's the only way that you're going to be able to see what's going on with the surgery. I don't know how invasive, but I know that you can use YouTube. Y'all know I get dodo. All right. So again, morphology. I want you to look at that. Primary malignant. Now listen. In your step-by-step book, you're going to combine this section with your ICD-10. So it's going to be derived. Let me give you this the same way. I don't know why my son on. It might be the connection that's doing that. Okay, so let's put this up. Same way. Same way. And you remember the stop sign, right? You guys remember the stop sign. If you forgot, go back to your chapter so you can look at the stop sign. Okay, so I'm going to take that down only so you can kind of get used to what we're doing. So, hold on. I got my 3 and I got my 4. Okay, I'm going to put that up in a minute. I'll put it up right now. I'm going to take this down. She's asking for the ICD-10 from the Kindle. So I'm going to put that up real quick. Yeah, it's a little bit of a delay. I'm not sure why, but it's a little bit of a delay. I hit something and the whole screen kind of jilted. Okay, so there it is over there. And it could be the internet tripping out, but as you guys can see, I'm getting kind of creative with this, and I hope it is not messing up too much. Okay, so that's the Kindle. Let me take this down. And you know the Kindle can still help you. Hold on. How is it? Oh my God, it's 10:03. All right, so all right, it's 10:03. This is gonna be a 2-hour class. So we're gonna take a quick break, and then we're gonna come right back. Okay, I need to get some stuff together. I want y'all to see one of the tests that y'all gonna actually get. So those of y'all who are in the classroom, don't disappear, because I want y'all to see what the test looks like, and I want you to get the surgery in your head. Okay, get the surgery in your head, because when we start doing the coding, you do have to feel like you're in the surgical center or you're in the hospital. Don't be afraid of coding. Do not be afraid of coding. You guys see how I just boom, just made up that code from the description that we had, and I gave you that a whole long description, and I turned that into a code. It wasn't even a surgical surgery. It was just documented information, and I just turned it into a code. You're gonna be able to do that when you finish with this class. And that's why I need you to step fast on this class. The coding classes, yes, they are a lot longer than my billing class, and they are a lot longer than the coding, the medical terminology class, because now you're going to take that medical terminology and you're going to combine it with the coding. The diagnosis coding is not that hard. It's not that challenging. Um, the challenging part is learning how to code the procedures, and that's where I need you to make sure that you steadfast. So this is going to be a 2-hour class, and it is because I need to make sure that you guys are good with this. Okay, I try to cover every step to make sure we're good with this. Um, I'm stopping on the malignant neoplasms. I'm gonna put it up only because I want you to see. Um, they got a lot of conventions in here, so that's why I put this one up. So I hope you can see this. So the stop sign. Remember we talked about the stop sign. If you see that stop sign, it means that you need more than the codes that are there. These three codes. This is your category. So if you see something with three codes and it's just a category, it needs more. It needs more codes. Okay. So do not continue on when you see something and that stop sign is there and you need more codes. Okay. So I'm gonna put this on it, and I'm gonna black out for like probably 5 minutes. I'll give y'all 5 minutes till we come back. I'm gonna find a case so I can throw it up here for y'all so y'all can see it. Okay, so y'all can see what the case looks like. Okay. I don't know which one it is. Wait a minute. This is one, but that's not. Excuse me. So when you got two, there's two on there, but we never want to do that. This case was 54. Oh, she got it. It's not giving me anything. It's not. Mm-mm.
with this?
Huh? Yeah, I got this should be a ref. We can't get this back. Oh no, that's taking it too much. Okay. So we're back. So I did find the test that I wanted you guys to see. This is an actual test for someone that I might hire, uh, and maybe she doesn't have her CPC. So if she passes this test, I will still give her 90 days to get her CPC. But I just wanted to kind of give you an idea of, you know, what they look like and, you know, what it is. And, you know, if you do decide to work for a hospital or a physician's office, you know, everybody has a different type of layout. Okay, a different type of, you know, how I want to, how I want to hire my people. So, and you know, in a lot of cases, they hire people as long as they can pass the test. Um, so let me get it up. It's gonna take me like a second. Let me try to get it up while you're on. So hold on. I'm not gonna break for 15 minutes. If I put this up, it's because I'm messing around in here. So I am gonna put it up for a second, okay? Okay, so I'm just gonna put this up real quick just to kind of show you. I think I found the way to actually show it to you. So let's do a screen capture here. I'm gonna do existing window. All right, so this is actually it, and we're just gonna kind of shrink it down a little bit. So, some of you who are, again, you know, you're kind of new to coding, um, and you know maybe you haven't seen things like this before. Um, okay, so this is just a little slower than this one. That's why maybe you haven't seen this before. But this is an actual test. Okay, this is an actual entrance exam, and I'm just kind of I'm gonna go into it while you're looking at it. Um, it's your Sapphire PC colon exam, and it's pretty much just telling you, what is it. So please read all the directions for each section very carefully. Select the appropriate correct answer for each question. Okay, And this is pretty much, I'm giving you an idea of what the CPC is actually going to consist of. Um, and again, this one is multiple choice. I tried to take off most of the answers on here because this is a true document. This is a true document that I created for you guys. So I took some of the answers off of it. But we can stop right here. Okay. So I'm not sure what you guys are on. Maybe you are on the phone, and I hope you can see this. But I just want to give you an idea of what it's going to look like. So you see how this exam is like this? And this is a good one. And this one looks like it has 7 characters. You remember we read about the 7 characters a few minutes ago? This is pertaining to that. So this is where you would use that. You guys can use this as a practice if you want to. Um, it's pretty much a document. I pretty much can move it around and do whatever I want to do with it. But this is in the Sapphire class. When they finish at a certain point, they do get this. This they will get. After every chapter is a test. So the YTU, you guys that have um, no tests, you have tests in your exercise book. You have tests in your step-by-step book. You have tests in your medical insurance billing book. There are exercises in the language of medicine book that you have. If you join the Sapphire Academy, we have certain books there that are free for you. The language of medicine is also one of them that is free. If you go to the bookstore, there's also a language of medicine book in there. I think it's about, I don't know, $25 or something like that. And it's an ebook. You guys just gonna load that up. And remember, the medical terminology is what's going to help you. Okay, so medical terminology is there to help you. No medical terminology, no coding. It's just not going to be done. You guys have to speak that lingo, okay? You have to speak that lingo. So, so those of you who have just joined in, or those of you who are archiving, I think it is a good idea for you to go ahead and mess around with this and see if you can get it. How you would do it is just, pause and then just, write it down or whatever you need to. But I think this is a good little exercise just to show you what what it actually looks like or some. Now this is a 50 question test. This is a 50 question test, but these are only 2 just to kind of give you an idea on it. I'm just going to take it down just so we can kind of get back to our book. Oh, we got that up there? Yeah, true. And because I get thrown off when we start doing that. That's what we're going to start doing. But that's not what we're going to start doing. I want you guys to make sure in your step-by-step book, let me move over because that's why it's on that. Okay, so in your step-by-step book, I want you to make sure that you are doing the exercises. Okay, make sure you're doing the exercises. And the reason I want you to make sure let me see if this is fixed. I don't want it to show that again. Let me see what's up there. Yeah. Okay. So y'all know I'm still learning this thing. I don't know exactly how it works. But we'll get there. We'll get there. So I'm back to the step-by-step book. So I showed you that case, and I still have the case in there. I think I have it in there as one of those docs, and I think we're kind of getting the hang of this thing, y'all. We're getting the hang of this. We're getting the hang of this. So y'all let me know if y'all like this better than the other one, okay? Some of y'all who just came in, y'all missed the test. I'm gonna put it up there real quick. Let me see the media source. We take the macro down, and then we'll put this one up. So some of you who might have just walked in, that's 2 test questions that I just gave you guys. So you guys may have to backtrack and do those. I just want you to kind of get the funky feel to see some of those codes with the 7 characters. So that's one of my tests that I give, and you guys can take a look at that. Okay. So we just wanted to put that out there just so we can show you what's next. So anyway, the step-by-step book is what we are working in, and that's where you're at. So when you see that stop sign, you know that it is additional code, right? So if you have F10, you know that there's more codes to that. So malignant neoplasms, COO C962 C96. If it is a fourth digit, it is going to be subclassification for the fifth, subcategory for the fourth. Okay, I know I said that backwards. And again, you guys have already did this. You've already done this. I'm just kind of backtracking so we can finish with chapter 2. So make sure in the guidelines you look at those chapters. Okay? Look at those chapters. Okay, I have to go back to, I'm going back to the step by step because that's what we're working in now. You've already went through the guidelines, remember? So you already did your chapters. So let me get back to your step-by-step book because that's what you're working in. This is for Sapphire too. So Sapphire Academy, you are also doing the same. I'm in the workbook, not the workbook. I'm in the books book right now, and we're working on chapter 2. Do not do chapter 1 in the step-by-step book because we are not doing that. That's part of your medical billing. Okay? So, like I said, in your step-by-step book, you have exercises to do, the HIC for information, we just went over that. And again, in chapter 2, it also goes over, again, the alphabetic index consists of 4 sections. Yeah, you must know that. I want you to know that because that's something that probably be on your test. Index to diseases and injury, table of neoplasms, table of drugs and chemicals, and external cause of injury index. Okay, get that down on your index card so it can help you to retain that. Okay. Okay, there's one table located within the index of diseases, right? We see that when you go in there, you can go in there and take a look at it if you want to. You will see different type of sections in there, okay? I'm just going to read just a little bit right here. There is one table located within the index of diseases and injuries. This table is used to better list the subterms under the main term entry of neoplasms. So when you go in that section, you will see a table there. It's a long table from A to Z, but they're just letting you know that in the step by step because again, this is you getting used to your ICD-10 book, okay? And don't forget that coding, those 2 coding questions that I put up there. You guys go ahead and do those coding questions. I will give you the answers to those in a post. I'm gonna put those 2 questions up, and I'll put the answers in a post, okay? So if you guys missed that, when you archive this, go ahead and get that. Go ahead and get those tests back. So I don't have the window doc open, but I'm gonna open this right now for a few seconds. These are the 2 test questions that I just gave y'all. Try and get them. I don't know how you would get them. If you guys are on your phone, just make your phone bigger. So you guys that are a part of YTU, this is the only way I can think of how I can give you some of my test questions. But like I said, I'm gonna put it in a post. So you guys go ahead and get that, okay? We're just kind of going over what's in your step by step book, okay? And where we're at, because we have to make sure that you are par with your step by step book, okay? And the step by step book is complicit with your ICD-10 book. We have to make sure that you there's no way to get around it. You have to read the book. But with you doing your theory with me, and then you doing your practice, I think that you will be fine. I think you'll be fine. Okay. So let's take this and take that off, and take this down. Okay. So we don't need that up there. All right. So we're done with that. And next thing we want to do, and what I want you to put on your index cards, because again, you are recognizing your ICD-10 book. The ICD-10-CM index, that's the index that's in the front, right? Utilizes 3 levels of indentation in the alphabetic index. 3 levels of indentation. Your main term, they're talking about, open up your ICD-10. They're talking about the format of the ICD-10 words. So this is the first one, and the other one is indented a little more, and the other one is indented a little more. So the ICD-10-CM index utilizes 3 levels of indentation. Your main term indentation, your subterm indentation, your carryover indentation. Okay? Mm. And underneath it just is what the bold print is. We did that in the beginning. The main terms identified by bold print, but you guys read that in your guidelines. In here, we're just backtracking, and they're just giving you more intense work. Okay, and here is where they are showing you that. So you guys see how. Let me see if I can get this up right. So you here it is. So you guys see how important it is to have your book. They're showing you what the main term is. And yes, this probably will be part of some of your open and closed questions. Okay, that on the CPC. Some of your open and closed questions on the CPC. Okay, so just just kind of make sure that you have your step-by-step book. Okay, so main terms are capitalized and in bold print. Subterms are indented 2 spaces. As redundant as it sounds, they will give you this on the test. Okay, to the right under the term. So that phrase that I just showed you, just make sure you take heed to it. I'm on page 29 in the step-by-step book. I'm going to drop this up there one more time so that you can see this. I think I'm right here. Yeah. See this? This is what I'm talking about right here. And again, this is you getting used to your ICD-10. Now, you don't need to get used to your step-by-step. Your step-by-step is just merely identifying what is in your ICD-10. That's it. It's identifying what is in your ICD-10. Okay? That's what it's doing. So, again, you have some quick check references. Okay, what the code is. Well, here it says, according to figure 2, what is the code you would reference to in the tabular list for? Now, if you guys want to do these two and give the codes, you can. You can do these two and give the code. So, acute abdomen. Look in your index, and you're going to find this through your main term. Okay, and it looks like acute where abdomen. So you have a main term, you may have a subterm. Okay, the first one is aberrant basilar artery. So you have a main term, you have a subterm, and then you have your third classification carryover. Okay, so you can look for that if you want to, because remember I said the ICD-10, and there's some down here for you to kind of mess around with. You can. The ICD-10 is like a dictionary in the beginning. You find your disease. So I'm right here, main terms. I'm right here where it says main terms. Underline the main terms to be located in the alphabetic index in the following diagnostic statement. Now, it's just pretty much giving you, diseases or issues that they want you to look up. You can look those up. Try and look those up in your index, okay? And again, anything you do in this book, the answers is in the back of this book. Okay, I'm gonna hit this piece up right here. The subterms under the main term are indented. You already know that. Indented. So your main term and then your sub is indented. And let me go back to this, because something like this you may see on your main term, and then your subterm is indented a little bit. Okay. When you guys archive this, you guys will be able to see this. You guys will be able to see this when you archive it. Cause I know we took a break and some of you weren't here, but when you archive this, just make sure you get it. Okay. So again, just take heed to the main term, subterm, subclassifications, etc. They all are indented. The more in depth you go with the code, the more you will see indented. Okay, so the subterms under the main terms are indented to the right. They begin with a lowercase letter and are not bolded. These subterms, not the main term, because remember they said the main term has a capital and the main term is going to be bolded, right? Um, these subterms modify the main term and are modify the main term as in the main term is that's what it is. The subterm modifies the main term by adding other issues or adding or with issues. Okay. This is another convention that I'm going to give to you. This is another symbol, not a symbol, but this is another convention. Um, these subterms modify the main term and are called essential modifiers. Essential modifiers. I'm going to read that again. These subterms modify the main term and are called essential modifiers. If you have this on your CPC exam and they say, what, okay, these subterms modify the main term. Okay, what modifies the main term with a subterm? What's the answer? Essential modifiers. I'm going to express this right now. Y'all know I say this all the time. I don't care what test you're taking. The answer is in the question. The answer is in the question. Cases. The answer is in the... Look. Which one do we do? This one? This case, these two cases, the answers are already in the question. The answers are already in the question. That open and close, essential modifiers, the answer is already in the question. Do you have to retain it? Yes, because in order for you to know it, you have to be able to retain that. We got 15 minutes in this class. We have to be able to retain that. Okay? So make sure you get essential modifiers down on your index card. Okay? This is a good one right here. Okay? And dysphasia. 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 Anybody know what dysphasia means? Tell us what dysphasia means. Put it in the comments, or you guys send me a message and tell me what dysphasia means. Okay, esophageal, okay, pharyngeal, let me know what that means, okay. Muscular. And when you see, remember we went over C, dysphasia? Okay, so you can't see what I can see. Okay, hold on. There we go. This is where I am right here. You guys, we got the same book. The step by step is not going to change. It's going to be the same book. Dysphasia. Make sure you get dysphasia. That sounds like something that I saw on your test. Dysphasia. Incoordination. Esophageal, pharyngeal, C, dysphasia, muscular. R278. Go look up that code and tell me what it says. Okay. Put it on your index card or just identify what it says. If you write to you at 99,000 or you can send me a message, just pull it up so you can see what it says. Same thing for you, Sapphire Academy. Look up that code R27.8 because now you're almost getting ready to start looking up these codes. You're almost getting ready to start finding these codes. So you won't just find stomach. We have to find what's wrong with the stomach. So your main term is stomach. We need the subterm what's wrong with the stomach. Okay, subclassification more of what's wrong with the stomach. We're going more in detail. Okay, so the term in parentheses is newborn. It's non-essential and merely supplementary. The indented subterm are essential modifiers such as muscular. So you can't really see this, but you should have it in your book. Okay. It says esophageal, then there's a hyphen, then pharyngeal, then newborn is in parentheses, then it says C, dysplasia. Okay? Muscular, R27.8. Alright. Okay, so I'm going to show you this because they want you to see what the carryover is. So the carryover is still the indented. Okay? But when you see the carryover line, it's just over more. I know it's so small. I don't know if you can see it or not, but I didn't want to kind of like put it all over the whole screen. Try to like get a whole different view here. Okay, So again, you guys have your book. That's the carryover. Look at your book and read that section. Okay. So okay, that's fine. So we're still in that section. It's okay. I want to see if it's let us. If I want to just skip down, no, I really don't. We got to take it. We got to take it one day at a time. All right. So the tabular list you have already taken a look at. Okay. After referencing the alphabetic index, which what we just finished doing, we was referencing the alphabetic index, right? Uh, you will locate the codes identified in the tabular list. You can never code directly from the index. What does that mean? That means that if you find your code in the index, when you look for aberrant, what we were just looking for, aberrant, when you look for that, um, you still have to check in the back of your book for the code, just so that you know that it is the correct code. Okay? Every single code you may not find in it. If you can't find it, just go with what's in the index. Okay? And that's going to be up to you when you take your test. So hopefully you'll be able to find every code that you need. Okay. Rather, you must always reference the index and then verify the code number in the tabular list. If you get that on your test, if you're not doing it when you take your CPC, and they ask you a question about it, you have to, you know, that's the proper way to do it. Okay, the proper way to look for a code is to locate it in the index and then go directly to the tabular list and find it. Okay, one of your questions, do you code directly from the index? No. Okay, so no. If you get that on your test, you do not code directly from the index. Okay. The tabular list is a listing of all the codes available for assignment, including their description. We went over this, I'm just backtracking. Okay, I'm just backtracking. Okay. Where the exact word is not found, which we already did in the tabular list, go with what's in the index. We already did it already. Okay. So the index also has descriptions of words that it will be a lot different from your index. We did that already. I'm just backtracking. You did your chapters, so you guys remember we start talking about the chapters. How many chapters is it, y'all? How many chapters is in the ICD-10 book? I'm gonna put this over here. How many? Now, what if they ask you this? How many chapters are in the ICD-10 book? Next question. Do you code from the index only? What's your answer? Y'all can think about it. What I'm giving you is some of your little hit hacks that you might have on your test. Okay? That you might have on your test. Okay, so we already went over, I'm not going over it. What I'm going to go over are the chapters. Because you remember section, then the chapters, right? So we know that your first chapter is what? Your first chapter is infectious disease. If you have some type of codes that entitle a disease, where are you going to find it? Where are you going to find it? I'm going to put this in here. Where are you going to find it? So if I say, what is chapter what is chapter 1? I'm saying, what is chapter 1 code range? So what is it and what is the code range? Okay. Chapter 2 is neoplasms, C00 through G49. What do we call codes that are only 3 digits. What do we call codes that are oh, 3 digits? Okay, what do we call codes that are only 3 digits? So, if you see 3 digits, what do we call those codes? We went over that. Yes, we did. So you should know. Okay. So, um, for endocrine, nutritional, and metabolic diseases. We went over that section kind of sort of yesterday, and that more or less the diabetic section is there. We also went over this in the language of medicine. So remember, if you want the language of medicine book and you don't want to join the class, you do not have to. You can go to the bookstore and get that book. That's $120, $140, but $25. Okay, so go to my website and you can download that book for $25. Okay, and if you see any this is for my YTU students. The course is back to what it normally is, and I pulled out the grant, so I didn't add anything else in there. And I didn't put it back to its normal, but I did have to put it back because the school has started already. If you guys see some type of discount in here somewhere, let me know what it is and I can give it to you. But if you guys get ready, if you guys want that book, make sure you go to my website and get it. Okay, so again, we're kind of counting down. Okay, we're kind of counting down what we need to do. Okay, so we have behavioral health. Remember, we went over that in the language of medicine. That's chapter 5. This is the ICD-10 book. It is in the same type of format that the language of medicine is. When you guys know some of this because we got familiar with it when we were in medical terminology class, right? So 6, disease of the nervous system, code range G00 G99. Chapter 7, disease of the eye and adnexina. Okay, H00 to H59. Okay, now the subclassification and subcategories and so forth are not added on here. They're just giving you specifics. Okay. 8, disease of the ear and mastoid process. 9, disease of the circulatory system. 10, disease of the respiratory system. 11, diseases of digestive system. 12, diseases of the skin, subcutaneous tissue. 13, diseases of musculoskeletal system and connective tissue. 14, diseases of genitory system. N00 to N99. Chapter 15, pregnancy, childbirth, and the perineum. Now that is going to be a doozy. The code range is 0, as in 0009A. When we get to this section in the procedure book, make sure you have your highlights with you because we're going to definitely have to highlight codes that look and sound the same. Okay, so chapter 16, certain conditions originating in the peritoneal period. Okay, definitely complicit with 15. 17, congenital malformations, deformations, and chromosomal abnormalities. And that's Q00 to Q99. Now, remember, a lot of stuff in the language of medicine book, you might know somebody who has that. You might know somebody who, might have a congenital infection or who might have, ADHD or autism or something like that. Remember, we had a, very detailed class in language of medicine. This is pretty much the same thing. Now we're going to be talking about the diseases. So remember, we talked about the nervous system. What does the nervous system consist of? What part of the body is the nervous system? Now we're going to talk about what diseases can persist in the nervous system. Okay? So chapter 18, signs, symptoms, and abnormal clinical and laboratory findings, not elsewhere classifiable. Aura, you always know it will be aura 002, aura 99 when you know that it's a sign or symptom that nobody knows what it is or they just cannot find it. Even if it went to the lab and it came back unknown, it's still going to be an aura code. Okay, and in the aura codes that we're talking about are the diagnosis codes. Okay, it is a diagnosis. It is just not a confirmed diagnosis, or we just can't find it, or we're not sure what it is, or later on we might, and then they will change it eventually. Um, 19, injury, poisoning, and certain other consequences of external diseases. When I say external disease, y'all know what that means: a house, head, car, or something like that. It's not a sickness. Chapter 20, external causes of morbidity, car, fire, Chapter 21, factors of influencing health and contact with health services, Z code Z00 to Z99. Uh, these type of codes are used for prenatal care, for primary care visit, your pap smears, your yearly mammograms, things like that. Okay, chapter 22, codes for special purposes, UOOU 84985. So, we used this section was created for when COVID came. Okay, I think it's U19. Um, find COVID in your ICD-10 book. But again, those are all the chapters that are in that book, in the ICD-10 book. And are we going to go over all those chapters, Miss Lambert? Absolutely. Every single chapter we would go over. Okay, let me show you where I'm at right now. Okay, there I am. So some of this is going to answer some of your questions from over there. Here I am. So just make sure that you read the guidelines. When you take your test, after you finish and you're ready to start working, it's not going to be that invasive. Um, how I like to do is when you guys take your test, it's easy. Boom, 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 boom. That's how you're doing it. Boom, boom, boom. I have a pre-test that has 150 questions in it. Um, and I've been using the same test for, I don't know, like a few years. But it gives you that feel of taking your CPC. It gives you that type of feel of taking your CPC. This one is different. This is like an entrance exam. Um, if you haven't taken your, let's say you haven't taken your CPC. Your CPC it's like $400 to take a CPC, and you still have to be a member. It's like $200. A lot of people don't have money like that. So you sharpen your skill. You still sharpen your skill. Sharpen your skill and go in there and say you get ready to get this job, CPC or no CPC. You don't have to put it on there if you feel like you know it and you can't afford to take the test. Put it on the app anyway. You went to school, you studied for it. You not put it on that. Apply for the coding position. Apply for the coding position. Do you have your coding, your CPC? No. That should not stop you from applying for the position, because when you do and you want this coding test, you want this coding job, they're gonna give you a test like that. You pass that test, you got the job. They give you 90 days. By the time you get paid, you got your money. You see what I'm saying? So don't think that you have to have the CPC before you get hired as a coder. Okay, you don't. You don't. Y'all know I'm putting it. Um, I had a coder, um, which I do it all the time. I don't even wait for CPC. I hire my girls anyway. If you pass that test, me and you gonna work it out. Because I understand, and you don't have that kind of money all the time. Get the job. Get your job. Explain it. I'm taking it in 2 weeks. I'm taking it in a week. I'm taking it in a month. No, I don't think 2 weeks. After you start getting paid, you got that $400. That's when you're taking it. Okay, so I definitely wanted to kind of put that in there. Okay. Now we're still in chapter 2, but again, we coming down to the wire, and ICD-10 begins with A and continues through Z. Yes, we know. So you've done your reading in your ICD-10 book. Now you are doing your step-by-step book. So this is what you guys should be working on in your step-by-step book. Okay. Those of you who are in the Sapphire Academy, you have exercises in your workbook, and then you have your tests that are in the Sapphire Academy. Okay, which I'm when I finish with this class, I'm jumping into to Sapphire. Okay, uh, I just want to make sure that you guys are all on the same page. Now, look, I'm on page 32 in the step by step, and I just want y'all to see where I'm at. Make sure that you understand what this is. Okay, and it's just giving you the letters for the sections, just for the chapters. It's giving you the letters for the chapters. What are the chapters, Miss Lamb? The chapters are the same sections as the diseases. The disease chapters, remember endocrine, neuro, stuff like that. Okay, I'm saying neuro, but y'all know what I mean. Okay, so it's a form of you getting used to your book. Okay, getting used to your book. I don't know what that is. This thing be popping up all kinds of stuff. Okay, so that's what we want you to do. So if you guys have any questions, make sure you send them to me. I know I'm messing with this thing over here. Okay, I don't even know how to get down. Y'all know I'm still working on this. Listen, let me tell you, so this thing gives me a hard time, but this thing does exactly what I wanted to do. I'm telling you, it does exactly what I like it better than the other one. I like it better than the other one. What does this mean right here? It says top fans. What does that mean, top fans? Get out of there. I seen somebody do that to me before with the top fans things. Um, I was on a chat one time and they had, I kept getting this thing over my head. I don't know what it was. And then now I see what it is. It's the top fans thing. Okay, and now don't ask me what happened to my chat because I don't know how to get it back. Okay, there it is. So, but now I know what that thing is. Okay, I know what that thing is. So, but it's already 11:03. This class is done. This class is over. I'm just going to be closing out, but I want you guys to let me take that off, to make sure that you are doing your homework. Okay, we are in chapter 2, and we're going to finish with chapter 2. Okay, and I just kind of let these classes go slowly because I want you to finish. All right, so you're going to be doing the rest of this work. I'm probably going to do another one, and we probably can do it tomorrow. I'm trying to finish with chapter 2 prior to Friday. So the chapter formats is also in the chapter 2. Okay, it's also in the chapter 2. I'm just going to show you real quick. So any of you who are stepping into this classroom, this is going to tell you about your chapters and your blocks, okay, and your subcategories. And don't forget what that stop sign means, okay? Don't forget what that stop sign means. So chapter, remember I said chapter, block, okay? Block as in what chapter this is. Category, I'm sorry, y'all know I gotta have this coffee. Okay, category says 3 characters. Subcategory, remember we talked about the subcategory, okay? 4 characters. Subclassification 5 to 7. 5 to 7. So you guys see right here, the more in depth it is, the more that it explains what's wrong with the patient. M2.5, this is a code. You guys can look for this if you want to in the tabular list. Pain in joint. Okay, let me put this down. Pain in joint. Okay. M25, 3, your category. Your 5th digit is your subcategory. Okay. You going 5 to 7 is subclassification. So let me show you. MT25, pain in joint. Pain in joint. What joint? Where? See how I want more? Pain in shoulder. Right? M25.50. Which shoulder? pain in the left shoulder, M2552. I'm right here. So if you guys see how I put that out there, it's like you're asking yourself, where is this? What are they talking about? Um, and it's explicit. It's telling you directly what they want, and it's showing you how they are coding. So remember, in the index, it's like a dictionary. Find the disease. Find the system of the body that is hurt. Then you're going to code that. You're going to see the code. You're not making up codes. The books have the codes already. That code that I made up this morning was just out of sheer showing you how codes are created. This is going to be your go-to. I know I'm over. I'm supposed to do it for 2 hours anyway. We started at 9. Did we start at 9:30? We started at 9:30. Okay, I did promise this to be a 2-hour class. So, I know I don't want to drag y'all on forever, but this is crucial for you guys to do. Know what the block is. A block is a group of 3 character categories that represent a group of conditions or related conditions. It's pretty much the description of what you get ready to look at. Okay, and we did this. I'm just backtracking. Category, subcategory, subclassification. Make sure you go over it. Make sure you go over it, because we are soon going to start coding the diagnosis. Okay, if you guys need more on this, then I'm a hold. Then we're going to do this again. Okay, we're going to do this again. Italicized type, remember? So just remember some of what you see in the book. This is where your index cards will help you. This is where your index cards are going to help you. Okay. So let me see what's in here. The code for the ring. Okay, so chapter 2 does give you a couple of fancies, which I do want you to try. I do want you to try this. So these questions here in your step-by-step chapter 2, go ahead and do those. Your ICD-10 book, right? And they have these here already. So what are you going to do to find this code? What are you going to do to find this code? The code range for mental behavior and neurodevelopment disorders. They want you to find where these are. I ain't going to give you the answer, but you know mental. So they are asking you, what chapter is that in? Is that how some of the questions look on the CPC? Yeah. This is what you call an open and closed question. You mastering your CPC or ICD-10 or HCPCS book prevents you from page to page, because the answers are right there. But they want to see, can you get this answer within 2 minutes? You better get this answer in 1 minute, because you need to save some of your time for the longer cases, all right? So yes, you're going to do that. Official instructional notations. So they're going to give you some questions on the conventions that you already read. Remember what I said, just repetitious. Okay, and this is cool because they're going to give you a coded shot. I like that. You're going to go over the brackets, parentheses. We went over non-essential modifiers, essential modifiers. Remember there were 2. Non-essential modifiers are words that may be used to clarify the diagnosis but do not affect the code assignment. So make sure that you decipher between essential modifier and non-essential modifier. I think that was my toughest one, essential and non-essential. Okay, so using the ICD-10 alphabetic index, locate the following main terms. And identify if the bolded subterm is an essential modifier or non-essential. So stop right here. I want you to stop right here, because we probably gonna have to do this one together. But if you can, you guys go ahead and try it. Otitis externa, I want you to go ahead and try it. Okay. So you're going to locate the main term, and then you're going to identify the bolded. Identify the bolded as in subcategory. So you're going to find those codes, both of them. So if you find otitis, right, they want you to see what the external is. Okay. I don't know what that was. Okay, so colon. Okay, so we finished with that one. Subacute, congenital, if you want to, but I want us to do this in class. But if you guys are good, fine. The colon, we're still doing conventions down here. Colon and with, and you remember we went over that. Um, Code J38 is assigned to identify the disease as one of the vocal codes. Okay, good. This is just pretty much, again, you guys going over your step-by-step book. I know it's already 11:11. Going over your step-by-step book. Okay? The more you go over it, the more practice you get. The more practice you get, the more savvy you get with the coding. Okay, I'm just kind of scrolling down. Excludes, chapter 1. I know they go over chapter 1 explicitly. That's why I'm so used to going over chapter 1, but I would prefer another chapter. Okay, and it's telling you code first, use additional code, how to code first, when to use an additional code. Okay, we already went over that, but I'm not, when we come back into this, I'm starting from a little further. I'm starting from exercise 2 to 4, where it says essential and non-essential modifier. So we're going to do that together. But if this class is finished, you guys can do that on your own. But I'm still going to go over that. Okay, I'm just kind of going down to see what else you got in here. ICD-10 official guidelines for coding and reporting. Same thing. I'm still in chapter 2. We're in chapter 2. Excludes, which is excludes. You guys already know that an exception to the excludes definitions and circumstances, two conditions are unrelated. Okay, so we already did that already. Just make sure that you read it again if it is not clear whether the two conditions involving and excludes one note are related or not. Okay. Related as in the patient is coughing. The patient has the flu. Are they complicit? Yes. That's what they're talking about. Okay. They're related. The patient has a whooping cough. Okay. Which is a difference. If you hear somebody with like that, it could be COPD. If you hear somebody just the cold. I'm not a doctor, but I've been around this stuff so long, it's ridiculous. If I had some money, I'd go back and be a doctor. I'd be a doctor by the time I get 70, right? Okay, so, this is cool. Okay, so right here, this is where I want you guys right here. Section 1, I'm going to say decimal A, decimal 18. Now, I got to show y'all this because this is what I was showing y'all earlier, how those codes are. This is generally a code, how they identifying this. You're going to find that area. It's generally a code they make. 1A, B, period, B, C. That's basically a code. Okay? And here is the 7th character and placeholder. Now, remember we did do this at the ICD-10 briefly. But in the step-by-step, I want you to go over this step-by-step. You're going to read this. Tomorrow we're going to go over this. I only have a few minutes left. We're going to go over this. But I do want to read this portion. I do want to make sure that you go over it. I'm on page 40. This 7th character and placeholder X. We went over it, but you're going to go over it again in the step-by-step. Okay. For codes less than 6 characters that require a 7th character, a placeholder X is assigned for all characters less than 6 for the initial encounter of a sprain of an unspecified acroclavicular down here. I'm hitting my joint. The correct code as shown. It's showing you what the correct code is in figure 19. Go look for this code, S43.50. Let me know when y'all have it. I know. When you used to teach it in the classroom and then you do it online, you almost feel like you're in the classroom. And y'all gotta apologize. I'm talking to y'all like y'all in the classroom, because that's what we would do. My students would be looking for this. If I say go find this code, everybody is to look for this code. They got 10 minutes or so, and then I go around and make sure everybody has the code. So y'all gotta do the same thing, okay? Follow the instructions under the carrier. It's just telling you to follow XYZ instructions. We are going to go over this explicitly. I don't want to rush through this, but I do want you to go over this. So this would be your last, okay? Initial encounter, subsequent encounter, and sequela. It will be either a D, A, D, or an S. Okay, so I'm just running over it real quick. Following the instructions under category S43, a 7th character A is required. In order for the A to be 7th character, an X is added as a 6th character. Because they need to know, is it an initial encounter, a subsequent encounter, or sequela? Remember we was talking about that sequela? And if they want to know this, if this is necessary and it needs to be added, it will tell you in your book, needs a 7th character. Your 7th character is good. Initial encounter, subsequent encounter, sequela. If you only got 5 codes, if you only got 5 digits and you need a 7th character, which is the A, the D, or the S, then you need to go ahead and put the X. So you see how that's more, see how it's more justifiable now. I'm gonna show y'all. You see how it's more justifiable now than it was in the ICD-10, where it's, because by the time we get to ICD-10, we should be doing this too. That's why it's complicit. That's why I always say open your ICD-10 with your step-by-step book. Okay, so this is where we're at. So I want y'all to definitely read that. All right, I'm just kind of going down in your chapter 2. But all the same, they talk about the 7th digit, they talk about the cross references, the C to C also. Same thing that we went over. But this is your work, and this is what you're going to do. Okay? They have questions in there, so you're going to do those 2. Questions. Okay. Okay, so the rest of all the bottom look like questions. Yeah. Main division in the ICD-10 manual. That's what you just going to fill in the answers. You're just going to fill in the answers of this, okay? So, last class tomorrow. I can't do class tomorrow. I got to go out early. I have to go out early tomorrow. I don't know yet, but I'm going to let y'all know. It might have to be Thursday. There'll be no class tomorrow, so I'm letting you know. There'll be no class tomorrow. Okay? So, this class... why did I move back? This class is, I was trying to move this. So this class is over. Okay. And I'm going to take me off in a minute, but we're going to see y'all next class. We're going to see y'all on the next class. Let me see if I put it in here. I don't know. I mean, I hit something else that shouldn't be on there. But we definitely want you to make sure that you get in on all of the classes. Okay? Make sure you get in on all the classes. Because if you miss something, you could always archive. Okay? Don't feel like if we do something, you wasn't here and you didn't get in on it, I'm just messing around with this. You're gonna miss out. You're not gonna miss out. Okay? If you miss something, it'll be okay. Okay? It'll be okay. You can always email me, discussion board me. Let me know, what you want. Let me know if you missed something, and we can just kind of go over it. Okay. So do not miss the next class. Everything is open book. This is my website. It's 11:20 and we're going to shut class down. We'll see you next time. Your next class is actually Friday, but we may finish out this starting from exercises 2 to 4. Let me just get back to that page. Because there are exercises in here, terms and parentheses, C and C also. That's tests that you're going to do. test that you're going to do. Terms in the index are listed by. Alright, so we're stopping at the cross-reference. I'm stopping at the cross-reference. Where you see seventh character, okay? That's where we're gonna stop at. And there will be one more class on the guidelines, and then you will do your own tests, and you will do the tests that are actually in the exercise book. Alright, so let me just see what this is right here. So we got the ICD-10-CM, the ICD-10-CM format, the index and the tabular list, official instructional notations in the ICD-10-CM. That is what we should have studied. So we're almost done with this. I'm gonna do one more class because there's still a little bit more in that chapter 2. Make sure you guys read your ICD-10 guidelines again, match them up with your chapter 2. Okay, and then we're going to move on to outpatient and reporting guidelines. First listed unconfirmed. Yeah, that's going to be a long one. So there will be another class. So you guys got one more class to this. You got one more class to this, okay? So I want to see you guys next time. It's already 11:22. This class is over.